Hello everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty, and today we will be starting with the respiratory system, Okay. In your respiratory system, the first thing that we have is your ARDS, that is nothing but your Acute Respiratory Distress Syndrome. So, what happens? ARDS is basically a disease characterized by acute lung injury. There will be acute lung injury. First, there will be the acute lung injury. After 1 week, what happens that this ARDS basically develops. There will be diffused bilateral pulmonary infiltrates that will be there. Next, there will be severe hypoxemia, that is the O2 requirement, the oxygen requirement will be decreased. Okay, see this figure, what you are able to appreciate, you have the lungs and here you have the healthy alveoli. You have the healthy alveoli. Then here you are able to see that the alveoli are not pink, they are not healthy, so they are your unhealthy one. The unhealthy one, or the patient have ARDS. Okay. What is the etiology? What are the causes? You have the causes as either there can be direct cause, like there can be any injury. There can be pneumonia, like your bacterial, fungal or viral pneumonia. Then you will have the aspiration of content. Then there will be aspiration of content. Or there can be any inhalational injury. Like maybe the person has inhaled the toxic fumes or the smoke. There can be sepsis. There can be trauma and acute pancreatitis. Burns. If there is a massive blood transfusion, there occurs the transfusion related acute lung injury, that is nothing but your 𝗲𝗵𝗵𝗺, and this you will read in your surgery lectures very beautifully. There can be drug overdose or there can be disseminated intravascular coagulation. What is the pathogenesis? First, there will be injury. Injury to what? Injury to your lung. Then what will happen? There will be a damage to endothelial and epithelial layer, which will eventually lead to the alveolar damage, So what is the stepwise mechanism? Let me just explain you that also. First one, there are triggers or insults, like there I have told you there will be trauma. After the trauma, what happens? What get activated? You have the neutrophil activation. Then there will be the cytokine storms. Like all the interleukins will get active and there will be they will recruit the neutrophils as their new president. Then there will be a damage. Damage to what? Damage to your neutrophil. Then there will be a release of reactive oxygen species, protease and platelet aggravating factors. They will result in the damage of capillary, and after the capillary damage there will be finally the alveolar damage. There will be emotional damage of alveolar. Okay, what happens is there is alveolar-capillary barrier disruption. Like these are your alveoli. Here are your capillaries, cute little capillaries that you have. What happens is there is a disruption. There is a disruption of alveolar capillary barrier. As a result of which, what happens? There will be a loss of surfactant and the lung compliance will decrease. As a result of which, endothelial and epithelial damage will be there and fibrin thrombi formation will be there, which contributes to your ventilator perfusion mismatch. That is the V/Q mismatch is there. Tell me, what is the normal ratio that is there in your V/Q that you have read in your physiology lectures, that you have to tell me. See, this is the pathogenesis. What is happening over here? You have the trauma. There can be any chronic disease as well. The person develops sepsis. Sepsis is what? The infection that occurs in your blood. Then it goes to the blood vessels, which causes the inflammatory mediators activation, finally causes the ARDS. What is happening in the ARDS? You have the epithelial injury. Then there are type 1 pneumocytes that are involved, that are nothing but your cells. You have the neutrophils and you have the cytokines. They are forming the cytokine storms, that are the activations of your interleukins. There is a intercellular junction dislocation. Are you able to appreciate this barrier, right? So this is a very, very beautiful diagram or a very beautiful figure. Please, when this question of ARDS comes, please try to draw this diagram, okay? Next, let's look into the morphology and the pathology. These are the gross findings which you will be able to appreciate. You are able to appreciate some small holes that are there. Some small, very small holes that are there. This is how it looks on the gross appearance. And in the microscopy, you are able to appreciate this. You are able to appreciate this. This is whole pink, right? This is whole pink. It does not have the neutrophils inside it. Next, that we will be studying gross and the morphological. In the gross one, they will be heavy, firm, red and boggy lungs due to the congestion and edema. You are able to appreciate it beautifully. They are red, boggy and the congested. Red lungs, okay. In the microscopic feature, there will be exudative phase of 0 to 7 days. In that, there will be intestinal or alveolar edema. There will be the hyaline membrane. There will be the hyaline membrane disruption. And you know guys what? It is the hallmark feature. Just like we have read about the hallmark feature of apoptosis. What was it? You have to tell me. You have necrosis of type 1 and you have the capillary congestion and neutrophil infiltration. Second phase that you have is the proliferative phase. What happens in the proliferative phase? You have the type 2. You have the type 2 pneumocyte which causes the early fibrosis. As a result of which there is organization of exudates. So this was all about the proliferative phase. The third phase that you have is the fibrotic phase. The third phase that you have is the fibrotic phase. Fibrotic phase is more than 21 days. What happens here? There are dense infiltration, interstitial fibrosis that is there, and the alveolar septa that is there, it basically gets thickened, okay. What are the clinical features? The clinical features will be, the patient will be having dyspnea, there will be tachypnea, Okay, what is tachypnea? There will be increased in the inspiration rate. There will be increase in the inspiration rate. That will increase. That will not improve with the oxygen therapy. But the signs you will be able to appreciate when you do the auscultation. You are able to appreciate there will be the diffused crackle signs, right? Just like the sounds that you hear of that chit crackles, right? That you have the pop-up ones. Just like this, you are able to appreciate the crackle sound on auscultation. Then there will be the use of accessory muscles, right? There will be the use of accessory muscles in respiration, during your respiration. And you will read about the accessory and the main muscles in your anatomy or the physiology. You might have read there. What is the diagnostic criteria? We have a very important diagnostic criteria, that is your Berlin's criteria. That is your Berlin's criteria. What happens in the Berlin's criteria? What is there? You have a range of 100 to 300 millimeters of mercury. If it is less than 100, you will name it as severe ARDS. If it is in between 100 to 200, you will name it as moderate ARDS. And if it is in 200 to 300 range, you will name it as mild ARDS. So this is the criteria that we used. The PaO2 and FiO2 we take into the consideration. It is nothing but the ratio of PaO2 and FiO2. Okay. In the imaging, when you do the imaging, what you are able to appreciate? You will be able to appreciate bilateral opacities. You will be able to appreciate bilateral opacities. Okay. Next, you have the investigations. You will order for the arterial blood gas investigation. Then you will order for the what? Then you will be able to order for the chest X-ray. Then you will order the HRCT. Okay. In the ABG, what you are able to see is there will be the respiratory alkalosis. You have alkalosis and you have acidosis. So here you will be able to see respiratory alkalosis. Alkalosis means all K losses. All the K ions are lost. Okay. Then in the chest X-ray, you will be able to see, in the chest X-ray, you will be able to see the bilateral diffused alveolar infiltrates. In the HRCT, you will be able to appreciate the ground glass opacities. Ground glass opacities. So these are the key findings that you will see in your HRCT, chest X-ray and HRCT, chest X-ray and ABG. Okay. Next, what are the complications you have? The complications that we have. First one, there will be respiratory failure if the person is on prolonged ventilation. Then there will be pulmonary fibrosis. Then there will be barotrauma from ventilation like your pneumothorax and pneumomediastinum. There will be ventilator associated pneumonia. Obviously, in poor countries or the countries who are in a stationary phase, who are a developing country, here ventilator associated pneumonia, and you will read it in the chapter. In this chapter only we will read it about the ventilator associated pneumonia. In the developing country, it is so common. Okay. Next, what is the treatment you will give? For the treatment, first one is the journal principle. We will follow the protocol. We will admit the patient to the ICU. Then we will treat the cause. The person may be having sepsis, the person may be having trauma, aspiration or pancreatitis. Then we will give the supportive therapy. Then we will give the respiratory support. After that, you will give the mechanical ventilation. Mechanical ventilation. Okay. What is the prognosis? There are chances that there is 30 to 40% of the mortality. Survivors, if the patient survive, there are chances that the patient may develop the restrictive lung disease. Okay, there are chances that the person will develop the restrictive lung disease. Let's just learn what we have read in the ARDS. So in the ARDS, what you need to remember, it is due to a acute lung injury. Then you have a healthy alveoli and the unhealthy alveoli that are there. There is what the pathogenesis, there is alveolar damage that will be there, cytokines will get activated, there will be neutrophil infiltration that will be there. Then we have read the gross, we have seen the gross appearance and the pathological appearance. Investigations, ABG, in ABG you will be able to see respiratory alkalosis. Then you have the HRCT and the CT plane that you will order. Criteria that you use, Berlin's criteria. Great. Now we will be solving this question. Question says, what is the most common cause of ARDS? Is it the aspiration of gastric content? No. Is it trauma? No. Is it acute pancreatitis? No. So the answer is sepsis. Okay. So guys, if you are, we are just done with this chapter, and if you are having any sort of doubt, please feel free to ask me. Feel free to DM me anywhere. Okay. Thank you so much. I hope I made this chapter interesting for you all. Thank you.